The following is a local resident producers program. The program content is the sole responsibility of the producer and does not necessarily reflect the views or policies of CATV2, Oshkosh Community Media Services, the City of Oshkosh, or Time Warner Cable.
Hi everybody, welcome to Eye on Oshkosh. Cheryl Hentz here, and I'm very pleased to be joined this evening by two people who both are employees of the Aurora Medical Group and Aurora, I'm going to screw this up, I know. Tell me the other part. Aurora
Medical Center.
All right. Aurora Medical Group and Aurora Medical Center, both in Oshkosh. And we're taping this on October 22nd. This has been Breast Cancer Awareness Month. We wanted to do this earlier in the month, but schedules being what they were and so forth, it just didn't quite work out. So, but better late than never, because breast cancer can strike anyone at any time, and so better to bring you the message now rather than never. So, very pleased to have them both here now. You know, we've got an interesting story here from Becky. You are not only a nursing supervisor, but you're a breast cancer survivor.
Yes, I am.
And we have, it's really a very, I think, inspirational and touching story that you shared with me and about a month or two ago, and so we definitely want you to tell that story a little bit later on. But one of the things that we definitely want to get out of the way first is you know, some breast cancer facts. Now, what I was able to find is that this year, an estimated 192,000 women in the U.S. will be diagnosed with breast cancer. Breast cancer is the most frequently diagnosed cancer in women, and it's the second leading cause of cancer death for women in the U.S.
That's right.
I did not know that. And, you know, one other thing, we're talking about women here primarily because that's typically who it you know, affects.
Sure.
But men can get breast cancer as well. In
Yes.
fact, I served on a committee with a man who had breast cancer. Do you guys see men in your clinic at all?
Yes, we do.
You do, for breast cancer
Yes.
screenings and so forth?
Well, if their doctor thinks it's necessary, they will come for a mammogram.
Okay. Well, we'll talk about that a little bit later, because having had several mammograms in my lifetime, I'm not sure how that works with a man. So you being...
Same way.
Wow. There's not much there. There's not much there. But we'll touch on that a little bit later. But, you know, why are mammograms so important? Maybe we should start there, and then we can talk about who should be getting them and that kind of thing.
Well, there's no way to know if you have breast cancer until it would get advanced and where it would develop maybe a lump or, you know, it's a screening tool. It's to check for breast cancer, because you can't most often feel it, especially in the early stages. You won't feel it, and it doesn't usually present as pain. So there's really no way to know. You don't even know what type of breast tissue you have, if you're more at risk to develop breast cancer, or if it's harder for the doctors to detect it in your breast tissue until you've had a mammogram to know, which is why it's so important to have that baseline that will determine for the future. Everything gets based off of that. So your normal, my normal are all going to look totally different. If I compared yours to mine, it would be scary. But if I compare mine to my old one, oh, well, that's just your normal. So it's always important to get a baseline, to know find out what your normal is, what type of tissue you have if you're more at a higher risk, Obviously, the dense breast tissue can easily hide and mask early cancers, whereas as you get older, your breast tissue turns more to all fat, and it's much easier to find something in just fat tissue.
Sure. Well, we hear so much about self-exams, and certainly that is probably one of the best places to start. That's something that
Exactly.
women should be doing every single month. But as you said, you know, sometimes it's so small. How small can something be detected through a self-exam? Do you know?
Oh, I should have brought up necklace I have. It depends on how often you do it.
Mm-hmm.
If you rarely do it, you might find a lump the size of a golf ball. Like one day, oh, there's something there. More like a grape if you occasionally do it, you know, every couple months. More the size of a small marble if you do it regularly.
Okay.
A mammogram could catch it the size of a grain of salt.
Mm-hmm. Yeah.
And especially with the new digital technology that we have, you can really capture those so early ones, and that's even becoming a challenge for our surgeons, because how do you treat it when it's pre-cancer?
Yeah,
You know,
yeah.
it's really catching it early, and it's
Sure.
it's great news for women. It's
Well,
a
I think
great
that's why the
prognosis.
survival rate has bumped up, you know, so dramatically. And
Oh, yeah.
you're a testament of that. Although we'll find out from your story that you didn't do some of the things you were supposed to
That's
do.
right. But she looks great, doesn't she?
She does. She absolutely does. But you know, the other thing is when you're doing these self-exams, they really can be very misleading. I mean, you can feel lumps, and there's a lot of things that it can be muscle or tendon. There are a lot of things that can cause lumps. You know, if you're
Yes.
drinking a lot of caffeine or whatever,
Oh, yes.
you know, it can cause lumps, and you know, we don't want women to be freaking out. So really, a mammogram is the best way to go.
And it's still important to know what your normal is, even to the touch. If your provider would feel something and be alarmed, and you could feel it, say, oh, no, that's me. It's always been that way. And the self-exam is just as important as the baseline mammogram.
So we always hear that women at the age of 40, that's when they should start getting mammograms. And that's the general rule of thumb, but that's not necessarily the case all the time. There are other times when women should be going in, correct?
Absolutely.
Yes.
Okay.
It is yearly at age 40 until through your lifetime, yearly. But if you have a mother that has been diagnosed, or a sister, especially the mother, if your mother was diagnosed at age 40, you really need to start getting your mammograms at age 30, 10 years prior to her diagnosis. And obviously, if there's someone in your family, that always heightens your awareness, and you know, it's always good to see your provider and see what they say if you're a good candidate to start early.
Okay.
But obviously before age 40, if you find something,
Or if you have pain,
or that too.
you know.
Yeah.
So, okay. So, what happens? I mean, I know I'm not asking for my benefit, but what for those women out there who either are approaching the age or the time in their life where they should have one because of certain circumstances, or for whatever, they've just never had one before. They've
Sure.
put it off, and believe me, I know a few people who
Sure.
have done that, and they just don't want to go for whatever reason. There are some who never see a doctor. You know, I just
There's so much anxiety with a mammogram.
yeah,
There
yeah.
really is.
So help allay some of those fears for us.
Okay. Well, we do everything we can to ease their nerves. We sit and chat for a little bit, go over some family history. It's always good to come in knowing about your own personal history, as well as, you know, it's hard to sometimes get it out of these older relatives what your family history is, but it's good to know that as well. And then we just get them relaxed. We talk for a while. I explain everything. Let them touch the machine. Let them see that you know, they're really in control. If they don't tell us if it's getting too tight or if it feels, you know, really uncomfortable right in this area, we don't know. I mean, you watch for signs. You watch for, you know, the squinting of the eyes if they're doing that.
Are the eyes popping out?
We haven't lost any eyes yet. But we do use a mammo pad. I think we're the only ones that use that, and it's a adhesive piece of foam that fits onto the mammogram unit, and it's soft and makes it more comfortable. And we'll gently apply pressure, and either until we get to the tightness that the breast feels taut, or if the patient's really hurting and feeling it, then we'll stop. And with the new technology, it really helps. We don't have to go as tight, and the paddles are made different where they have some flexibility to them. They're not just, you know, a stiff platform coming down.
Mm-hmm.
So it's really all about getting in touch with your technologist and really, you know, just communicating and stuff. We've had several baselines this week, patients that are here for their first time and had anxieties, and you know, you take the first picture and they'll be like, that's it? That's what everyone was so excited about. And you know, but if one person has a bad experience, you're going to tell people, and you're going to tell people it was bad.
Yep.
And those that say, oh, that was nothing, they don't tell everyone.
Yeah, yeah.
So it's really, I mean, give it a try. I mean, we will do anything we can to help ease your fears, calm your nerves.
Well, and the rooms are dimly lit. It's no bright, glaring lights or anything like that.
It's only women around.
Yep. You know, and I've even had from time to time soft type music and that kind of thing. It's very well, I don't want to use the word intimate. That doesn't really apply, but it is kind of an intimate type setting, if you will.
Well, and it doesn't need to look institutional because you're not sick.
Right.
You're just, it's maintenance work. You're getting things checked out.
It's precautionary.
You're normally healthy.
Yep. Yeah. And I too have to say that I've, you know, yeah, you feel a little pressure, but I've never felt, and it's just me, but I've never felt this huge discomfort and, you know, tremendous pain that you sometimes hear from people. And so, but as you said, everybody is different, and
sometimes it's not related to the breast. Sometimes it's the medications, or like you said, if you use a lot of caffeine in your diet, you know, that can make it really tender as well. So, you know, if you knew you were going in for the first time, if you could lay off the caffeine for a couple months, I mean, that's kind of hard, a couple months, but
yeah.
Or even to pre-medicate. A lot of people will take some ibuprofen or acetaminophen ahead of time, just to kind of take the edge off.
Okay. Now, how long does it take to get the results? I know for myself it's usually been about a week, but you know, I keep seeing these commercials on TV for Bellin up in Green Bay, and they're getting the results before the women even leave.
In writing the same day,
okay.
It says.
Yeah.
It's if someone is very anxious for their results, we will do what we can to get them the results that same day.
Okay.
Obviously.
Okay.
But it's always best for the radiologist to what we call batch read, where you know, when we get like 20 mammograms ready, then they'll sit down and read those. Get in the mind frame. I'm reading breast mammography, and read them all in a row together. And that's always helpful, because once you interrupt, you know what it's like if you're busy doing something and a kid is like, Mom, you need to do this right now. Are you going to do your best work at that moment? It's always best to get in the mind frame, you know, I'm going to do this now. And so, but certainly we can interrupt them, and they will look and give us a result. But it's always best to let them do it in their time.
Sure. Well, in that way too, they're not looking at it in a hurried state, and maybe later on seeing something that they didn't see initially.
Right. You know. And you know, some women will come, and it's tricky if you don't have your mammogram at the same institution year after year, or if you don't know ahead of time where your last one was, because we do always compare and look for that baseline to know what your normal is.
Sure.
So if you come and you have not notified us where the previous are, we don't have them there. If you come and then say, oh, I had it in Green Bay, my last one. So then we have to get them, and how long it takes for the mail to get to us, that will delay your results, all of those things.
So all the different, you know, we keep hearing about all these electronic medical records and this kind of thing. So obviously you can probably send things digitally or electronically within the Aurora Medical Group. But if someone, say for example, had been living up in Green Bay, they did have something done at Bellin, for example, now they're living down here, and they're going to Aurora, you don't have a way of electronically or digitally getting those records from Bellin? Things aren't interfaced like that yet?
The systems that the images are stored on are similar to the different car companies. You know,
Okay.
with GM, Chrysler. So you can't really use one part in another. So
Okay.
sometimes they can burn a disc, and we can pull up the disc on an image or on our monitors, and that works. Sometimes it doesn't if the
Okay.
systems don't communicate. So then
Yeah.
the facility may have to print film, and all those things are regulated. We have to have a certain true to size image printed on our film, and there's places that we have to print for, and obviously places that aren't digital yet need a film image to look at to compare with their
Okay.
most current.
All right. Getting results, you know, it's happened to me once or twice in my lifetime where you get a letter or sometimes you get a phone call saying, you know, we saw something that doesn't quite look right, you know. And I remember the very first time.
You panic.
I did. I freaked out. I mean, I was a basket case. And of course, they couldn't get me back in for like another week or so. And, you know, and that's a lot
It
weighing
is.
on your mind and your heart and everything else. But that's actually not a very uncommon thing.
No.
Is it?
No, not at all.
And
There's
what-
probably at least five people a day that get called, sometimes 10. Some days none. It really depends. You're imaging a three-dimensional object in a two-dimensional plane, and you know, from year to year, if the breast tissue's rolled a little differently, things overlap differently, and things are going to look maybe a little different. So we just need to find out, is there really anything going on there, or is it just the way the tissue's overlapping, and you know, maybe you used a different angle on the side view this year than last year. And of course, once in a while, it is something real, that we need further pictures of, or maybe an ultrasound, or maybe they would recommend an MRI. But most often, it's not anything.
Right.
But you don't want to take that chance that it could be something and let it go. But I know what you mean. Everyone goes there.
Yeah.
Women go to that place. You know, some people will have their obituaries writ before they come in. It's just
Wow.
and some people are they call me every year. You know, and everyone handles things differently. And
I know one nice thing is Aurora Oshkosh has extended hours, both morning and night, so we can get in before work, after work, or during work, depending on, you know, it's kind of.
but then when you get called back, you have to come during the hours the radiologist is there, because they will look at them immediately and order any other tests that are needed
Yeah.
to get you results that day. So you're walking out knowing what's going on.
Yeah. Are there other things that can cause something to look like a little blip on the film too? Like I know they don't want you to have deodorant on and that
Yes.
kind of thing. And I've always wondered about that, but I've never asked
Well, the
because, you know, I
deodorant
start
can
thinking
cake.
about other things. But
You know, it gets cakey. It can cake into the pores or folds of your skin. And same with powder and the new glitter lotions that they have the little glitter sparkles in them. Those all can show up like those fine, tiny little calcifications that look like little grains of salt that are some of the early cancers
Yeah.
look like that. So, you know, it's always good to have been cleanly washed before you come in, and also, you know, the lotions also help so you don't slide out of the machine.
yeah, and we don't want that.
You don't want that.
And of course, you know, if someone forgets and they put, because I'm a creature of habit, I get out of the shower and that deodorant
We
goes
have
on.
wipes to take it off, and we have new deodorant spray to put on when you're done.
Yep.
So, you
Yep.
know, if you have to do it in the middle of the day, we're all set for you.
Yep. All right. Well, I want to touch on the male mammography just a little bit, because we did talk about that a little bit before. I would think that, I mean, it's embarrassing enough for some women to walk in and have a mammogram done. But I would think for a man, that's even more embarrassing. And how do you, because it is just usually women there,
Right.
how do you work this if a man is coming in for a mammogram? I mean, is
We
there a
have a
special
separate
area for
yes.
him?
We have a
Okay.
separate waiting area with the TV. They can sit and watch TV until we're ready for them, and then we bring them in the back way, not through the women's waiting area. and take their pictures and then take them back to that separate waiting area again. So the women don't have to worry about a man walking through the department, as well as the man doesn't want to be seen there either, really.
Right. Yeah, because, you know, I mean, I guess I never really thought about men getting breast cancer.
It's the mammary glands. Everyone has them, and women's develop, and some men's, you know, do, and some don't, and sometimes, you know, cancers, obviously, gynecomastia is a very popular thing with men, and then sometimes that can be flared by, I think it's like sometimes changes in medication, and often it's older men, you know, where usually if you put on a little weight, it doesn't take much to have enough tissue to get into the machine.
Yeah. Well, yeah, and that was my thought here, because, you know, there's not much there on most men, and I know from having been through this myself, you know, you got to get things pretty flat, and I'm not even, you know, there's so little there, really, to work with.
But if there's a problem, you can tell.
Okay.
Even if we can't get the top views, the side views alone that show the pectoral muscle, you know, men are always flexing their pecs.
Yeah.
You can, even if we could just get one of each side view to compare the normal side to the side they're having the problem with, and just to see if they look the same, or the same with women. You know, the same with the baseline. If you don't have a previous, we compare it to the other breasts, because often they're symmetrical.
Sure.
And in a man that's having a problem, they don't match each other.
Yeah. Do you see a fair amount of men at Aurora?
Some months none, some months at least one a month.
Really?
It really goes in. It kind of goes in streaks, kind of like breast cancer does.
Yeah.
But definitely they're out there.
Yeah. Well, and you know, here again, it's something that people should not take lightly.
No.
You
And
know?
it's nothing funny. I mean, if your husband would need to have it, you know, to tease him about it. You know, of course, everyone's different. You might be the type you could tease. Your turn, you know, kind of thing. But often it's necessary.
Yeah, sure. Is there anything else that women need to know, or men need to know, about mammograms, and anything that might allay their concerns, or anything like that before we move on?
I can't think of anything. Becky, do you think of anything?
Just that it's an X-ray. You know,
It is
it's
an
just
X-ray.
an X-ray.
Yeah.
And some people, you know, think this is something painful, but it's really just an X-ray if you've ever had an X-ray.
I like to tell my patients it's just photography.
Mm-hmm.
I'm the photographer, and we just have to capture the picture the way, just perfectly,
Yeah, yeah.
to get the results.
You may not know the answer to this, and I'm going back to men again here, just because it is kind of a fascinating thing. I mean, obviously, in women, if chemo and radiation don't help, then they need to do a mastectomy. Do they do male mastectomies?
Yes.
They do?
They
Okay.
do.
All right. Boy, I'm really getting an education here tonight. And you guys are just, see, this is why you work in this field. You're just so matter-of-fact about it. It's just, and I'm kind of sitting here thinking, wow, I didn't know that. And, you know, it's amazing. Okay, well, let's, why don't we take a short break here, and then when we come back, we're going to talk with Becky a little bit about her story and so forth. So we'll take a short break, and we'll be right back.
Thanks.
Dear Mom and Dad, well, I finally have some time off, so I'm writing to tell you that I'm doing well. We have good days and bad days over here. We try to remember the good ones and get through the bad ones. Mostly we have each other, and that's what keeps us going. And Mom, since you asked, if anyone wants to help, just tell them to contact the USO. You can't believe how much they do for us. With love, your son, Michael.
Every year, the U.S. Department of the Treasury receives about 1.4 million reports of problems with paper checks. Checks can be lost, stolen, or delayed. If you still receive Social Security payments by paper check, Treasury wants you to know about a safer, more convenient way to get your money. The the Direct Express Prepaid Debit MasterCard. The Direct Express card is new and is available to anyone receiving Social Security benefits, even if you don't have a bank account. Your monthly benefits will be automatically placed onto your card account each month on the day your money is due. While other debit cards cost money, it is possible to use the Direct Express card for free to make purchases, pay bills, and get cash at thousands of locations nationwide. There are no sign-up or monthly account fees. No more waiting for the mail or worrying about lost or stolen checks. Call 1-877-212-9991 or visit www.usdirectexpress.com.
We were in an emergency situation. We don't have extra. We have a little bit of water and a little bit of food. A meeting place, no.
No.
I don't think we have a first aid kit.
We have tuna fish, we have beans, we have canned tomatoes,
True.
you know.
That's true, but that's really not survival food. Tomato paste.
Yeah, well, yeah.
All right, and we're back now. We're going to get Becky involved in this conversation now. I'm not sure, you brought some props, and I'm not sure at what point you want to bring these up. I know the one will come later, but do you want to show anything else right now, or should we just talk about your story? Or
Sure. Let me show this quick. A couple things that we're doing for breast cancer awareness is some of the girls in surgery are making these hats, but they're using the breast cancer awareness material for anyone to buy, but then they're also giving these hats to women who come in for a mastectomy or lumpectomy or partial mastectomy. So it's kind of nice. We also are selling some jewelry for raising money for breast cancer and selling tickets to buy a kayak, a pink kayak.
A pink kayak,
wow. Pink kayak.
Look at that.
I was going to strap it to my back and bring it, but it just didn't fit in my car.
Wow, look at that. Amazing.
So, and all the money goes for breast cancer, which is awesome. And then we're doing the breast cancer awareness bagels, and they called it Bagels, Beauty, and Boats. So the breast cancer awareness bagel, then the jewelry, and they're doing pink extensions in their hair,
wow.
And then the boats, of course, the kayak. So I'm hoping to win the kayak.
There you go.
I gotta buy a few more tickets.
Who's is there a sporting goods store in town that is donating the kayak, or where is it coming from?
I believe Aurora purchased it and then is selling the tickets, but all the money will go for the foundation, which is for breast cancer.
Okay.
So,
all right,
yeah.
good. Well, these are adorable.
Aren't they?
They
yeah.
really are.
And they do special things in surgery for the women who are coming in, which is kind of nice.
Or men.
Or men.
I have to keep saying or men too in my mind. So let's talk about your story, and it's just amazing to me. I first came in contact with you for an article that I wrote for a nursing magazine.
Yes.
And you told me your story then, and I was really moved by it. I really was, and I thank you for that. And that's why when this subject came up, and I was trying to rack my mind, I had tried making a few other calls, as I told you. That didn't work out, and then I thought, you know what? Because I wanted to have you on anyway because of your organization that you started, which we'll talk about a little bit later too. But I thought, you know what? She'd be a really good person to have on. So share your story, because you tell this all the time.
Well, at age 40, I received a letter from my physician, Dr. Green at Aurora, and it said, now that you're 40, you should come in and get your mammogram. But really, I was a busy woman. I thought, yep, I should get my mammogram, and I think that at that time I played softball 3 nights a week, plus every weekend, and I ran every day, and thought, cancer. Healthy people don't get cancer. At age 41, I got another letter. It's time for your mammogram. They hounded me every year, and believe it or not, I'm ashamed to say it, but at 48, I found a lump. And it was an accident that I found a lump. By that time, it was a bigger lump. Like Cindy said, if you get your mammogram early, they can find it the size of the grain of salt, but I found it was larger. So I called my OBGYN and said, I found a lump. Do you think I should come in? And they said, absolutely. So I went in and they whooshed me right over to the breast surgeon and said, this looks suspicious. And next thing you know, I was in the breast surgeon's office and he did an ultrasound. He said, this looks suspicious. Let's send you down for a mammogram. They whooshed me right downstairs and I got a mammogram and they said, we're going to do a biopsy. And that was my first mammogram after I found the lump at 48. Yes, I had those letters piling up.
And you're a nursing supervisor
I know. Well, I was working in the ER at the time. I wasn't a nursing supervisor, but
still, you worked in healthcare.
I know.
They're the worst.
We're the worst. And I guess I thought because I ran every day and I played all these sports and I was very healthy, very healthy. I ate all the right things and I don't drink, don't smoke. I can't get cancer. But yet I did.
Yeah.
And if I would have had a mammogram, they would have caught it earlier. So instead, it went into my lymph nodes and had to have extra surgery because of that. I had a partial mastectomy. And then I had to go back and get all my lymph nodes out of this arm. So now I wear a sleeve that pushes fluid back because I have no way of getting the fluid back except holding your arm up like the Statue of Liberty all day. And I had to go through chemo and radiation because I let it, because it went too long. Yeah. So.
How long was the whole process of chemo and radiation, Becky?
About 8 months.
Okay.
You go every 3 weeks for chemo and you sit about 4.5 hours, and I had 3 different chemos all at the same time. Well, one right after another. Took about 4.5 hours, and then 3 weeks later, do it again. But there were things in between. 24 hours after, you get a shot to build your white blood cells, and they always watch your labs and things like that. When chemo was all done, then I started radiation. And that's 7 days, 5 days a week. So.
And the reason that you ended up with a partial mastectomy and then having some lymph nodes taken out was why? Because I think most of us think, okay, radiation and chemo, that should pretty much do it, or we hope it will anyway.
Sure. Originally, as we talked on a break, I went to see a breast surgeon, Dr. Kiefer, and he talked about all the options. He didn't think a full mastectomy was appropriate at that time. He thought if it was okay that I did chemo and radiation, he would do a lumpectomy. But when he got in there, he did warn me that he could have to take out quite a bit. Depends on what he sees when he gets in there. He did do a partial mastectomy, and then there was enough there, and the lymph nodes looked clean, but they send them for pathology, and they cut them and dye them, and there was cancer in them. So then I went back about a week later and had them all removed out of that arm.
And of course now, that was at the age of 48, you were diagnosed.
Right before my 49th birthday.
Not a good way of celebrating it. And by the way, your birthday is today.
Yes,
correct?
It is.
So happy birthday to you.
3 years ago, just about a week ago, in 3 years, I was diagnosed.
But you're cancer-free now.
Yes.
And how long has it been since you've gotten the all clear, if you will?
Well, after radiation, I'm still screening. I just had my mammogram on Monday, and a DEXA scan. And
now, what is that?
That's to study your bones,
okay.
And I have to do it a little more often because chemotherapy kind of wreaks havoc on your bones.
Okay.
And the mammogram I got my results right away. There's a difference between diagnostic mammogram and just a screening if you've never had an issue. If you're diagnostic, the radiologist, correct me if I'm wrong, Cindy, reads it right away and you get your results right away. Mm-hmm. But then after you leave, they do study it more, so you could be called back, but chances are you're not. So.
Okay. Well, you've just, you've got just the best attitude, and I think that probably has helped you too through all of this.
Sure.
They say laughter, pets, and just having a good spirit and attitude about things. What was going through your mind? Because that has to be, you know, as you said, you ate well, you exercised, you work in healthcare. I think sometimes people in healthcare think, we're immune to that.
We're invincible.
You can't touch us.
Yeah.
You know, but what in the world was going through your mind? It must have hit you like a ton of bricks. Or were you in shock?
It did. I think I was a little in shock. Even though I was a nurse, my husband came in with me to go over things with Dr. Kiefer. And Dr. Kiefer writes everything out. And he sends it home with you. And a couple things I said to my husband later, I said, I'm surprised he didn't talk about that. And he said, yeah, he did. And I'd go pull out the sheets he gave me, and I'd read through, and I'd say, oh, yeah, he did. And even though I'm a nurse and understood it, I kind of blocked it. I think you hear the C word, and you just block it out.
Well, that's why I think, too, it's good when there's something like that going on. I think it's always good to take someone along, whether it's a friend or a parent or, you know, a child, depending on what your age is in life, because you are blocking certain things out, not intentionally, just that's just the way it is. And plus, another person might think of additional questions to ask.
Yes.
You know, I know when we went through this with my mother-in-law with cancer, it was lung cancer, of course, but, you know, there were a lot of questions that needed to be asked, and they just weren't asking them.
Sure,
and so I'm piping up, you know. And, you know, but that's a good thing to know, and that way you're not missing something, too. Right. Now, in your case, you've got a really thorough doctor who writes everything out.
And you take it home with you.
Yeah, yeah. Most of us write things out, or we're trying to just, you know, commit it to memory.
Sure.
But there's a lot of things to commit to memory, you know.
Your emotional state just blocks your mind. It's kind of funny.
Yeah.
Because I thought I was perfectly calm, I was okay. My husband's been through cancer 3 times. So I was always on the other side of the table and always listened, always asked questions of the doctors. And this time I wasn't thinking. Yeah. It's just amazing.
Yeah, yeah.
Are you thinking now, taking that 20 minutes to have that mammogram 10 years prior maybe would have been a lot more time saving?
And that's why I don't mind telling my story, and I said that to Cheryl, is if I can catch a woman who says, I'm too busy, or I'm very healthy, I'll never get cancer. If I can catch one woman to go in and get their mammogram, I'll tell the world, because I hope they learn from my mistake.
Yeah. Well, and you know, you said you were always on the other side of the other side of the bed with your husband.
Right.
You're on the other side of the table or the bed this time too, being a nurse as a patient.
Right.
And that's one of the things that we talked about with respect to you know, the article that I had written. But you know, what is that like, being on the other end of the bed, or the other side of the bed?
It's odd, because you look at things and you think, wow, you know, and boy, was she nice, you know, and sometimes you hear what they say and you think, well, I'm going to start saying that. That sounded really good. Yeah. And then sometimes you say, well, I wish this would have been done, or nobody said this. And because I work there, I was able to pass that information along. And it's amazing how receptive they were, and because I was a patient. And I was passing along information that they needed to hear, in my eyes, needed to hear.
Yeah.
But for other patients, it might be the same for them.
Sure. So it's sort of like a quality control kind of thing, and customer improvement, customer relations improvement, if you will. And, you know, every business needs to do
Absolutely.
that, you know.
Everybody can improve, absolutely.
You betcha, you betcha. And so you're cancer-free now. How often do you have to go in and get checked? I mean, is it certainly every year, but is it more often than that?
Every 6 months is what I'm at right now. When you're first done, you see the surgeon. 3 months later, you see the oncologist, and 3 months after that, you see the radiation oncologist.
You're seeing everybody, aren't you?
Yes, and then you rotate.
So it's really a never-ending cycle.
Right.
It's just you rotate through who you see.
But now I'm on every 6 months, and soon it'll be every year.
All right.
So.
Well, that's good. You know, is there anything else about your story that you want to share with people before we get into the other, you know, the other aspect of what this has done for you? I
guess just open up and don't go to the internet for things. That's one thing I liked about Dr. Kiefer is he wrote out what he wanted me to research. He said, I want you to research this, this, this. So when I get your, he did the biopsy. When I get your biopsy results back, I'm going to be telling you if you're ER positive or PR positive, which is estrogen, progesterone, and that dictates what you're going to do, how your treatment is. He said, I'm going to talk about this, I'm going to talk about this. So I want you to research these items, but don't Google it. He said, these are the only websites I want you to go to. I want you to get accurate information. So I did, and when he phoned me with the results, well, first of all, he said, I'm going to be in Atlanta when your results come back at some conference. He said, is it okay if I wait till Monday? And I said, absolutely. Still thinking, I didn't have cancer, you know, it's just a lump. And
forever the optimist.
That's right. And then when he called me at home on that night, he said, hey, this is Rich Kiefer. And I said, well, you either have fantastic news for me or sucky news for me. And he said, well, it's the sucky news. And so he went through and he told me all about the different things. And because I had researched what he told me, I knew exactly what he meant. And then he told me, we'll talk about treatments later. I just want to make sure you're okay. And, you know, we'll see you on Monday.
Now, you mentioned that he didn't want you just Googling it and he wanted you to go to certain sites. I think that that's something that, you know, most of us are guilty of is we want to find something, we Google it.
Right.
We all know, or I think most of us probably know, you shouldn't just take everything that you read on the internet you know, you have to take it at face value. You can't take it as fact.
Right.
But obviously there are some reputable sites out there. Like, what are the sites that your doctor recommended that you go to?
One of them was Susan Komen Foundation. You can get a lot of good information. One was, I believe, called Why Me? I'm blanking on the third one. There was another one.
And of course, the you know, the American Cancer Society's website, which is cancer.org, www.cancer.org. So, okay, good. Well, I think you know, this has certainly made you aware of things that women are going through.
Yes.
Or men, as they're going through this process, and as a result of that, you've started a non-profit organization, and it is called necessitiesbagwisconsin.org, and we'll be putting that website address up as we talk about this. But tell us what the organization is and how you came to sort of start this here in Wisconsin.
Well, while I was wearing the little hats, because I lost all my hair, of course, anywhere I went, grocery store, I'd be just grocery shopping, and people would come up to me and say, you know, my mom wore those 9 years ago. My sister wore those same hats so many years ago. And they'd tell me their story, they'd be crying, I'd be hugging them, didn't even know their name. We're in the freezer section, you know, of the grocery store. Don't even know them. But I felt they'd always say, thank you for talking to me. And I thought, okay, this is exactly why I got cancer, because I'm giving back. But then your hair grows back, and I kind of lost, I was kind of not depressed, but wondering, now what do I do? My hair's growing back, so people don't come up to me anymore.
You can still wear the hat.
Yeah, that's okay. I'm glad I'm rid of those. But it was just kind of funny. I was at a loss, and about 2 weeks after I stopped wearing the hats, and my coworkers made me stop, even though my hair was only about that long, I went to a conference. Aurora sent me to a conference on patient-centered care. And so while I was there, I was supposed to be in a class, and it was pretty booked up. So I went down the hall to a different breakout session, and I peeked in, and the lady said, come on in. I said, well, what are you doing? She said, we're packing bags for breast cancer patients. So I thought, oh, this is perfect. I went in, and while she was telling me her story and why she started this company in Connecticut, tears just started coming down. And I'm not a crier, but they just wouldn't stop. So I knew that's what I needed to do. And what she was doing was teaching other people to take on their county. And she said, if anybody here wants to start an affiliate in their county or in their state, and so afterwards she said, this is pretty meaningful to you, isn't it? And I said, yes, I've been looking for a way to give back. And she said, well, what do you think? You know, do you think you could start this in your county? And of course I'm crying, and I'll just do the whole state of Wisconsin. You know? So we started going, and I started the company just on my own money. I asked my surgeon, said, can I bring these bags to you? And the woman from Connecticut gave me a few to hand out. And I learned a little bit more about them, bought some supplies, and I said, can I hand them out to your patients who are going to have mastectomies? And he said, absolutely. So while I did that, I became incorporated. And after incorporation, then you fill out scads of paperwork for the IRS, and a few $100s later, I made it as a nonprofit. And what that means is anybody who donates, it's a tax deduction for them.
Sure.
Which is really nice.
Absolutely.
That makes it a lot easier. So at Aurora, I'm on, you can give, you know, different United Way agencies, and I'm on there now. So employees can donate to my company, and it's kind of nice.
So again, it's necessitiesbagwisconsin.org. And what, now, is it just for mastectomy patients, or is it for any woman who's going, you know, who's got breast cancer, or a man who's got breast cancer and they're undergoing radiation, chemo, maybe some other kinds of treatment?
It's mostly for the person that's going to have a mastectomy.
Okay.
It's to help them get through. There's items in there for help after anesthesia, things like that.
Okay.
It's usually mastectomy because you stay overnight. If the lumpectomy is going to stay overnight, then I can give them that too. But it's mostly care to help them through their journey.
Okay.
And not so much after.
Okay, well, and you brought one of the bags with you, so maybe we
did.
can show the bag and some of
Sure.
the items that are in it, or all of the items that are in it, if we have time.
This is how the bag comes, and basically I meet with the person right now, or I have a designated person who comes and explains the bag to someone, the surgeon. I'll go over the pillows last because that's like the most important part.
And those are so pretty. They're colorful. Look at that.
Yes. And everything's donated, everything. People make these. I have 5-year-olds all the way up to 98. I have a couple women in wheelchairs. I have one woman who puts zippers in all of her pillows because she can't handle fine motor control, so she just puts zippers in all of them.
Wow.
But in the bag I have things like there's a folder in here and a notepad, so they can keep track of their paperwork that you get, because you get scads of it. And I put a homemade card in every single bag. I started just making all of the cards because I'm a scrapbooker and a stamper. But it got a little out of control, so now I ask for help. But it just is a blank card, and it says, we'd love to hear from you, and all the women write back. And they tell me what they liked about the bag and what they used. Odd things like men's sleeveless T-shirts, and we use those because you have a lot of bandages when you go home, and you have drains. And they use them to just kind of hold the bandages in. Plus, if you have lymph nodes out, you can't raise your arm very well. So what they do is you can stretch that T-shirt over you, and it's just a guy's shirt. You can throw it out when you're all done. Helps hold your bandages in, and you pin all your drains on, and you don't get your clothes dirty.
Okay.
The other thing it's actually kind of odd, we do send some bandages with them, but it's all surgeon dependent. But one thing that they use a lot in the bag is just a simple ribbon. It's a ribbon they put around their neck when they're going to shower, because you come home with drains, and all the drains have pins on them.
Okay.
Some people come home with 3 or 4 drains coming out of them, surgical drains. So they put the ribbon around their neck, they take the 2 pieces together and pin their drains on, and then their hands are free for the shower.
Okay. All right.
So it's not like a gifty items, it's just to help them through their journey.
Sure.
The other thing is the hospital kit. Because they can't move their arm real well, there's a water bottle with a pop top on it. There's Kleenex, there's Lifesavers, and chapstick for dry mouth with anesthesia. So
And that's really important, isn't it? Because you do get a very dry mouth.
You do, with the anesthesia. And this was all put on, or thought of, by a woman who went through it and didn't have a clue. So she wrote down everything as she was going through. I wish I would have had lifesavers. I wish I would have had lip balm. And that's how she put the bag together.
And this started where? Do you know where?
In Connecticut.
In Connecticut.
By
okay.
Maureen Lutz. She's the founder. And then every state or county, in my case the state, then you start your own affiliate and you are the president of the company. Everything is unpaid. All of our hours, anybody that I solicit help from, it's all volunteer.
Mm-hmm.
Everything is donated either by money, and then I stretch the budget as much as I can, or people donate supplies.
Now I'm seeing things here with, like I saw a pen with a certain company name on it. Now, is that just a pen that...
Somebody donated.
Okay, but it's not like the company donated it necessarily. Or do you have companies donating some things?
I do.
Okay.
I have Lutheran Social Services donated a bunch of folders and notepads. I have 4Imprint donated, right here in Oshkosh, donated pens.
Okay.
The water bottles I actually got through a grant by 4Imprint. They have grants for nonprofits.
Okay.
So one thing that we include in the bag is a pamphlet, and it's written by Maureen Lutz, the founder. And it is,
He'll zoom in on that for us too, I think.
Okay,
so.
it's called Woman to Woman, and it's basically, she tells women how to get ready for their surgery, how to get ready emotionally, how to get ready physically, how to kind of prepare your house for coming home after your mastectomy. And it's just letting them know that we're there for you.
Yeah.
I include a business card in every one of mine, and when I hand them out, or when I have somebody else, a designee, hand them out, I tell them, your community donated this, because they don't know how to give you anything. So what they do is donated supplies, donated money to help you through. And usually when people hear their community is donating to them, usually they break down crying, but they feel so good about it because you know, people don't know what to do, and you have a friend with breast cancer, you don't, sometimes you don't know what to do. So donating to a company like this or other, it's just a way to help.
Sure.
The pillows were designed to go home, especially after you have a mastectomy, for the seatbelt.
Okay.
To protect yourself because you're tender, or even put under your arm. And I know I just crushed the microphone when I was doing the seatbelt demonstration, but sorry about that.
I'll live with that.
Put under their arm because their arm is sore in the beginning. So if they have a bilateral mastectomy, which means both sides, I give them a bag and I give them a bunch of extra pillows.
Okay.
So.
Right. Well, those pillows, I mean, is somebody making those?
Yes.
Wow. Because those are pretty.
Even my granddaughter, who at 5, she was sewing, of course, sometimes you get Dora the Explorer pillows.
Well, hey,
but
she's a popular character.
She is. But yeah, we have a lot of people donating, and from all over. I have a surgeon that I met, and I met him actually at a shooting range. When I got cancer, I took up pistol shooting.
You weren't going to go shoot anybody, right?
No, just learned how to shoot. My daughter is a police officer, and I learned how to, I watched her shoot, and it was fun to watch, so I took it up. And one time we were shooting on a squad, and someone kept calling this man Doc. And so I asked him, what kind of doctor are you? And he said, I'm a surgeon. I said, really? We're going to talk later. And he said, I only do a couple mastectomies a year. He's in Stevens Point. And I said, that's a couple women. So anytime I see him, he takes more bags back to Stevens Point and hands them out to his mastectomy patients.
How many of these bags would you say you have given out in the time that you've been doing this, Becky?
About 300 now.
Wow.
About 300. And I just talked to someone from a hospital in the area that I'd like to get more too. So what I'm trying to do is hit any surgeon I can, and if they're willing to give them to their patients, it's all free. Everything is free to them.
Wow. Now, some of these things, like tape and bandages and things like that, obviously, are these things that if not for the bag, they would be getting anyway when they go home? Or after a mastectomy, do they just not give you these things? I mean...
It depends on the area. I know that Aurora, we give what they need, but a lot of times they might not need more bandages. So I just put a few in just so you kind of see the size. And then we have a list in there of what those sizes are and exactly. So if your spouse goes to pick up bandages, you can just take the list and say, I need some of these. I use paper tape because it's a lot easier. There's antibiotic cream in there, but it warns you. Make sure you ask your doctor first, things like that. But the things people find useful, of course, are the pillows, the ribbon in the shower. Because everyone, when I show them, they say, I was wondering what I'd have to do. Yeah. And I guess the biggest part of the bag is knowing that there's a connection. There's a connection between your community and you and your breast cancer, and that you're not alone, and we're here for you. And sometimes it brings up questions, and luckily I'm a nurse and I can answer some of them. People ask about drains. How do you drain them? You know, how do you keep up? Things like that. And then they might go home and think of other questions for their doctor. Sure. So I'm kind of that in-between person.
Well, and that's always a good thing to have, you know, kind of like we were talking about before. Okay, excellent. I just love these little pillows. Look at these, and they're so soft.
They are.
They're so soft.
We use the softest kind of filling on the inside.
Wow, okay. All right, well, we're down to about a minute and a half here. You know, I guess, you know, in closing, well, first of all, you know, I meant to ask you, how much time were you off from work because of all this? You didn't miss any, did you?
I didn't.
You worked it out so that you didn't miss any.
I didn't.
Explain to the audience how that worked.
Well, I was in the ER working, and I worked 12-hour shifts, so I was able to work 3 days. And then I planned my surgery around that, came back. I actually went back to work the next day. I had a drain in, a surgical drain in, and my surgeon saw me in the hallway and he said, does your surgeon know that you're working? And I said, he does. He really does. And he said, did your surgeon give you permission? I said, yes, I distinctly remember that under anesthesia. So, but I felt good. During chemo, you feel a little nauseous. Yeah. But anything, no matter what, I had Dr. Dar at Aurora. He was awesome. He kept me feeling great. I worked in the ER, and you know, you're immune compromised, but he kept my labs right up there. He watched my labs all the time, gave me medicine to counteract, and I swabbed people who were sick in the ER with flu and never got sick. So.
Excellent. Excellent.
Yep.
Well, ladies, thank you both so much for being here. Again, if you know of someone who is having a mastectomy, or you've dealt with it yourself perhaps, or maybe someone who's having one come up, it's necessitybagswisconsin.org. If you need additional information on cancer, you can go to cancer.org. The important thing is, if you're at 40, get your mammogram.
Absolutely.
Do not let that thing slide. And if you're having some other issues, you know, be sure and get your mammogram and talk to your doctor about getting one. And the thing is, you don't need a referral for it, do you, or do you?
Not for a screening.
Okay. So just for the mammogram itself, you don't. If there's a problem detected or a possible problem and you need an ultrasound, an MRI, a biopsy or something like that, that's a whole different thing.
Correct.
But just for the mammogram, no referral necessary. You can do that on your own.
And there's plenty of programs for those that can't afford that, or their insurance doesn't cover it.
I know from a previous guest, Well Wisconsin Woman,
Well Women of Wisconsin.
Well Women Wisconsin, whatever
Yes.
it is, that's one of the programs. What's another one that you know of offhand? Not to put you on the spot.
I don't know offhand. I know in the metro area they have some that are just set up by the hospitals that collections have taken care of.
Okay, all right. Well, ladies, thank you both so much for being here.
Thank you for
hopefully
having
we've
us.
given some good information to folks. So that's going to do it for us. We will see you next time. Until then, take good care. Keep your eye on us. We've got our eye on Oshkosh.